Hello and welcome to YouTube channel HealthQ, the place where our mission is to not only motivate you but help you to move on to the brighter side of the health. In today's video, I'm going to solve one most important question that has been asked by parents whose children are suffering from cerebral palsy. And that is, what is the ideal frequency of exercises that a parent should do for the child, or ideally should be done for the child. So, if you have this question in your head, make sure to watch this video till the end to get your answer. I am your host, physiotherapist Meghna Dave, founder and CEO of HealthQ Rehab, and my mission is to make sure that I can help you move better in your life. So, if you haven't subscribed to our HealthQ channel, make sure to subscribe it. Make sure to visit our HealthQ Rehab website as well as app to explore different rehab options that we have available for you and to learn lots and lots about your health and well-being. So, coming to the question for today. That is, what is the ideal frequency of exercise that you should follow for your child? The answer to this question is very simple. First thing, you need to understand physiotherapy, occupational therapy, speech therapy, any kind of therapy that you are doing for your child is not a treatment, but it's a way to train and teach the child to adapt to the normal activities and physical abilities that he or she is missing. As physiotherapists, our role is to make sure that all the physical functions that a body does, which is related to sitting, standing, walking, etc., is achieved. At the same time, occupational therapy focuses more on functional independence, on tasks that the child needs to perform on a day-to-day basis, like writing, picking things, doing tasks which require a lot of sensory objectives or a sensory decision making. Similarly, speech therapy focuses on training the child in ability to speak, right? So most of the parents think that physiotherapy is the treatment for the problem. Ideally, the problem is in brain. We are helping the child to develop that brain which has gone through damage with the help of retraining methods. So it's more like an education and less like a treatment, right? So when I say this, I mean that it's re-educating or educating the child to attain important life skills that are missing. Now, having said that, if you see the frequency, it's a very simple common sense thing. If you want to learn a skill, the more repetitions you do, the more consistently you do, the better and faster would be the outcome. So whenever a parent comes to us, we say this very simply, that if you want to teach the child to sit independently, for example, right? So that experience of sitting has to be repeated in a very consistent manner till the point the child learns the art of sitting. Now, most of the time the problem what happens is they feel that they need to do stretching also, they need to do this exercise also, that exercise also. Every exercise gets jumbled in the head of parent and that gets transferred to the child. So what we are trying to say is, you don't need to do so many exercises for the child. That is not required. But pick 1, 2 or maximum 3 exercises which are focused on attaining that ability that you are trying to achieve and repeat them in a very consistent manner. So let's say if you are doing for 10 repetitions for today, make sure to sustain or maintain that 10 repetitions for another 15 or 20 days till the point the child has developed the attainment or else developed the ability to do that activity for 10 repetitions with minimum or least amount of assistance. Let's say if your child is not able to hold the neck, right? So then give the child tummy time position for 10 minutes, 20 minutes, 30 minutes, whatever you decide or whatever you see the child is able to hold, and do that consistently till the point the child has been able to attain that position. Let's say you decide that child should be able to hold the neck in tummy time position for 1 minute. If that is your goal, then you have to make sure that you give practice of 1 minute tummy time every single day. Then you can make a decision, do you want to do it 2 times in a day or 3 times in a day, right? It's a very simple thing, but things gets complicated when there is expectation overload. Please don't put lot of expectation overload. I would say leave expectation aside. Expectation results are anyways not in your hand. What is what is in your hand is the ability to do the repetitions. So please keep on performing. Don't keep on searching for new and new exercises. Rather than that, stick on with 1, 2 or maximum 3 exercise. Give the repetitions so many times till the point the child masters their activity. So coming back to the question's answer, how frequently you should do exercise for the child? The answer is either 1, 2 or 3 times in a day, depending on how child is finding it fascinating or is okay to do and how much you are able to give time. Don't strain yourself and push yourself. If you feel that you can give focused attention to the child for 1 hour in a day, then just maintain that 1 hour in that same time slot. Don't do this thing that one day you will do in morning, one day you will do in evening. It doesn't work that way. Define a time, maintain that time on a regular basis. Let the child understand that this is my exercise time slot. Why you find good results when a therapist come at home and do therapy for him? Because he or she comes at a specified time. So it is trained inside the head of the child also that this is my therapy time. Similarly, you can make therapy time for your child as well. You don't need to depend on always on the therapist. Yes, therapist is required and will be helpful to you to progress on the exercise, but you have to do exercise at your level at home. Then only you will be able to achieve good results. So make sure to do your exercise consistently once, twice or thrice in a day, depending on the mutual time and energy that you can give and the child is also willing to give, and be consistent with that. That gives the answer to this question that mostly parents ask, how frequently we should exercise our child every day. I hope this solved your queries. If yes, make sure to like this video, share this video with your friends and family members. Do not forget to subscribe to HealthQ channel. I'll see you in another video. Thank you.